Rhys, and right now I'm at the Children's Hospital at Westmead, and I'm about to have my long-term follow-up checkup. Because when I was little, I was very sick, had cancer, and I got treated here, and now I just have to do the long-term follow-up. So I've just popped down to say hi to Luce after having my long-term follow-up appointment. So anyway, Luce, what's been happening?
Being interviewed by one of my patients, it's very nerve-wracking.
What's new?
Glad you asked me that, Rhys. A lot's happened, particularly in the last 6 to 12 months. We've been here at the site at Westmead for about 30 years, not quite. And time has come where we need to actually look at the way we do things and improve things for our patients. So what's new is that in the next few years we'll be designing and developing a new building for the kids out here in the West, and that's going to contain a brand new cancer centre, and that's what we're very excited about. We're just in the planning phases for that.
Nice.
Now, why this place? Well, the Westmead area, the precinct, has been identified by the government as one of the areas that shows the most promise for health. Because on this site we've got 2 universities, our fantastic children's hospital, which is phenomenal, a big, large adult hospital, and a couple of research institutions. So we've got everything in place to be able to make a difference to the care that we provide our kids.
I have one more question for Luce. What will, for the patients of today and tomorrow, will the new unit look like and be like?
Things will be different. We'll be able to have single rooms for all of our patients.
Single rooms! Yippee!
And we'll be able to have them in one cancer centre, not spread throughout the hospital. And we expect to design the rooms so that they're not only comfortable for the patients, but they're also age appropriate, so we look after adolescents.
Somewhere for teenagers. Yeah.
And that we look after the families who sometimes have to spend a large amount of time here.
A real bed, not just a fold-out bed for parents.
Did you know that young people with leukemia on average spend about 100 to 150 days in hospital over a 2-year program?
Really?
150 days, yeah.
It's huge.
So I'm not sure that our facilities currently help them all that much. So the new facilities will be designed to work out what can we do to make their time here as good and as best as possible.
Yeah.
It's really important that we look at their needs. We'd like to change our model of care so that young people spend less time in hospital.
Maybe even some treatment at home.
We don't make it hard for parents to go to work. That school times not as interrupted. So over the coming months, we're going to ask for people to assist. Sometimes it might be something as simple as donating blood or getting people to donate blood. Other times it might be time. We need time and we need their input to make sure that what we design is really appropriate for our families. But at the moment we're looking at, believe it or not, building that's 14 floors, 14 stories tall, and that oncology has the top 2 with a view out. Yeah, that's great. I think that people don't realise how unique we are, maybe because we don't promote ourselves, but we do things here that not done anywhere else. We look after all the kids with eye cancer. Did you know that?
Really?
Yep. From New South Wales and from overseas.
Wow.
We also do really specialised forms of radiotherapy called brachytherapy.
And that is why you should support the Cancer Centre for Children. You can do this by donating blood, stem cells, bone marrow, participating or helping to fundraise. Everything helps. Just do something.